And one interesting thing that we saw on this patient that was not seen on the first two patients, we got post-contrast axial T1 imaging, as well as a post-contrast T2 flare sequence on the right here. And this is where a contrast exam can catch some subtle findings that you may not see on a non-contrast exam. And here we see some kind of fuzzy nodular enhancement along the posterior aspect of the globe, right here, where the arrows are pointing to. And you can really see it stand out on that post-contrast T2 flare sequence here. So that is an imaging evidence of intraocular protrusion of the bilateral optic nerve heads, as well as enhancement of it. So this has been sort of described in the literature. And there is one specific one I'm thinking of, Dr. Kennedy's paper in 2019 that actually finds that it's a very sensitive marker for moderate to severe papilledema. So when you see a finding like this, it's most likely that the patient has a moderate, at least a moderate degree of papilledema.